Well, it took a lot of years. So I started working on it there, and that was in the 1950s. I just told the teacher, I told the faculty, you got to go at it with something besides the traditional through your ears. Teaching speech, it's got to be a better way. Our sound was particularly difficult because you can't see it, and the movements on the face are not very helpful. We can show them, hey, the tongue contacts the back of the mouth. Look at what it looks like. You don't have to guess. And that was the whole thing all the way, is get away from just plain guessing and get to doing something that you can see and use the full power of the sensory system you have. So you use vision, you use hearing, you use touch, you use the whole system in order to teach. So then twins that couldn't say the R, they'd been a whole lifetime as far as they were concerned when they couldn't say an R, and they didn't know, and that's what they said. They said we went to, every year we had a new clinician in the public schools, and every year they would try to teach us, and it was somewhat different from what the other had been done, and we still couldn't understand. And now I saw them, they were 16 years old, and it really embarrassed about not being able to say things like one of the children. Youth had problems with the R in her name, and and they're bright people. And when I said the R, they said, "Is that what the R was? Is that what we're supposed to? That's easy." And so over the 4 days, they learned how to say an R, but it wasn't habit yet. So I had suggested to them, go to a speech pathologist and get help from there to make it stable in what you're doing. And they did that. You want them to succeed as soon as they can. If they can see, if you can see, if your child can see, why struggle all those years without making the kinds of progress that you ought to make?